Hey, what's up, y'all? Happy Sunday, I guess. Sunday fun day. Sunday fun day for me is sitting in this recliner, waiting for my back pain to go away. I did it again. I throw out my back by just doing the dumbest things. It's never lifting. People ask me, they're like, "Oh, well, you're lifting a lot of weight." No, it's usually like putting on my underwear or stretching. I'm paying a personal trainer over at Lifetime to stretch me. Now, he's a large human. He used to play for the Redskins, offensive lineman. He's a big boy. But honestly, I don't even need his size. I'm so inflexible, that he just kind of leans into me, and it's like tearing my damn hamstrings and something that I need. I've neglected this. I've neglected this for many decades. So it's going to take some time for me to fix this part of my body, which is my flexibility. I did a yoga class last week and I couldn't even get through it, which is crazy. If you've never done yoga, you need to do it. You'll probably hate it, but you might love it. I hate it and love it. I hate it when I'm doing it because I can't hold the poses very long. I'm fairly strong in the gym, but you have me stand on one leg and do this and that, and I'm the worst in the room. So God did not build me that way, but it's a longevity thing, you guys. I'm in this for the long haul, and I'm gonna do some things that are uncomfortable to put me in a better position down the road. So anyway, that's what I'm doing this weekend. I'm watching some baseball. I couldn't go to church this morning, so I'm gonna listen to service. Probably my favorite service, Church of 1122 down in Jacksonville. Joby Martin, awesome. So I'm gonna turn that on here in a second. I've got the Georgia Tech game, North Carolina game on. I've got Alabama, and I think they're playing Arkansas later. So I'm going to watch some SEC Baseball Championship and NASCAR. And that's what I'm doing today. I'm probably not going to move much from this chair because I can't. It hurts too bad. Pain meds are on the way, and a muscle relaxer prescription. I tell my doctor, I can text her, I'm like, just don't give me 30. I've had a problem in the past with taking too much, so she knows. I'm like, I need to just get through these couple days, so she'll probably call in like 5. This is a pep talk, and I want to talk to you about a couple peptides that I'm just blasting right now. Whenever I get injured, and I do, I am an old guy and I push myself. So it's inevitable, whether you guys do CrossFit or lift heavy weights or, do any type of HIIT training, whatever. The older we get, if you push yourself, you're going to get hurt. And I really think the no pain, no gain is real, because if you go to the gym and you're on the treadmill and you're reading a book, you're probably not going to get hurt. You're also probably not going to get any results either. So for whatever that's worth, I'm going to tell you what I'm taking right now. Last night I did BPC 157. I did the 10 milligram bottle, loaded up the whole thing, and put that in my back. TB 500, I did the same thing, 10 milligram bottle. I did the full thing of that. And KPV, I did half the bottle of KPV, and I did 2, 4, 6, 8. I did 8 milligrams of GHKCU. And I think that's it. Today's my Retta day, which has nothing to do with recovery. I stay away from mitochondria. Peps on Sunday, I give myself a break. We've talked a little bit about pulsing. where you want on and off, on and off. Give yourself a rest break. I did my Tesamorelin this morning. If it was a real severe injury, honestly, if it was like a tear or something, I'd probably get some growth hormone and inject it in that area. So I've done that with some really, really bad injuries. And, we talk about the BPC and the TB500, the Wolverine stack, works wonders. But growth hormone, if you can get your hands on it, a lot of you can't. It's not often prescribed by doctors. You can for dwarfism and for AIDS patients. So if you have AIDS, you could probably get your hands on some. If you know anybody that has AIDS that doesn't want to use their growth hormone, let me know. But that used to be readily available. That's harder to get now. But synthetic growth hormone is truthfully, it's stronger than Tessa, IPA. Tessa and IPA are signals. They tell your pituitary gland to start pulsing. They work different pathways, so you can do both of them at the same time. CJC and Tesamorelin, different pathways. It's not redundant. I've talked to you guys before about the benefits of both. The visceral fat reduction is really big. You can be lean, you can look skinny, and have a lot of visceral fat that's just suffocating your organs. Tessa does an amazing job. They both do. Tessa's FDA approved for reducing visceral fat, but that doesn't mean that CJC isn't just as effective and more cost affordable than Tessa. They just went a different route to get their FDA approval. So it doesn't mean that Tessa's better. That's the route that they went to get their approval. So essentially, they work very, very similar. And anybody that says they can tell the difference between the two, it's kind of a placebo effect. So whatever you think, oh yeah, then I'm getting that effect. But truth is, they work very similar. The other truth is that real growth hormone, synthetic growth hormone, is at a different level. And everybody can take that too, by the way, if you can get your hands on a script. 1 to 2 IUs daily is a really therapeutic dose of that. But again, with injuries, if you were to tear your bicep or really rip your shoulder apart and want to speed up that healing, just like this is more anecdotal. You won't see this in probably any studies. I don't think so, but it's something us knucklehead gym rats have been doing for a long time, is you inject in that area for accelerated healing. So I'm gonna do another bottle of BPC 157 later. I'll do the whole thing, 10 milligrams. So I'll probably run 20 today. And if you've talked to me before, if you've taken it, you're probably, I recommend like 500 micrograms on a daily maintenance amount. Some of you guys have been injured and will go to 1, 2, 3, 4, but I'm consistent in saying you can take more with zero side effects if you can afford it and you really want to speed up recovery. You can really go high milligrams on both the TB and the BPC. KPV and GHKCU, same thing. We're taking GHKCU. It's not just for that copper peptide. It's not just for hair, skin, collagen, nails. It's for repair, tissue repair, and inflammation. So keep that in the back of your mind. It's not just for beauty. It is for recovery. That the copper is really, really effective. So anyway, that's what I'm doing today. Happy Sunday. Hope you guys are doing better. I'm doing fine. Me and Bubba, we're just sitting here eating bacon and coffee and chewing and spitting and I might be drooling in a little bit. I need to have somebody pick up. I will do, you know that I'm not a fan of prescription medicine if you don't have to take it. But when you need to take it, then you need to take it. And today, I need to have somebody go to CVS and pick it up for me. So when we do that, I'll probably be drooling later. And sitting here in front of the TV. So anyway, Bub and I, we're going for the Bulldogs here in the second game, Georgia Bulldogs, for the SEC championship. And there should be a nice tribute on NASCAR for Kyle Busch. I'm a big NASCAR guy, and he was one of my drivers. And we lost him. He passed away just a couple days ago, 41 years old. Getting back to that whole longevity thing, the guy's a multimillionaire. He's just beloved these days in NASCAR. A husband, father, son, and at 41, it sounds like he got pneumonia and it went septic. Scary. I've had a lot of friends in the hospital recently. My buddy in Knoxville keeps getting sick, and it's all you can say it's just coincidence. I think I know that God does things for a reason. So sometimes that really dark time when you're sick or somebody's sick, and my mom's cancer or certain diagnoses and setbacks in life are really blessings in disguise. And it's absolutely crazy how God works. But my mom's cancer, and she's recovered from that, and this last 6-7 months has been a challenge. But I know why God allows things to happen, because he's got a blessing on the other side. And it's so true. He's not going to give you anything you can't handle. Getting back to peptides, these are available for you now. The most common, frequently asked for, most popular are GLPs. I want to lose weight. There's peptides for a lot of different things, you guys. One of them that's probably the most well-studied peptide with the most clinical evidence is thymosin alpha. There's a couple variations of that are for immunity, and I'm taking those on a weekly basis now, because getting sick is no joke. Kyle Busch got sick and went septic, and he's dead. I mean, it happened really, really fast. So not that everybody needs to run and jump on thymosin alpha, but if you've got some aging parents, or if you've got a really poor immune system, some of you guys do for various reasons, a lot of it can point back to your lifestyle, diet, climate, environment. Just recognize that things don't just happen to you. Sometimes it's stuff that we're doing that are making us prone to having some of these problems. And then if we recognize that and we want to be proactive, the best defense is a good offense. I'm going to start asking this question to everybody that I talk to. What's your biggest fear? What is the one or two chronic disease, chronic illnesses out there that you're afraid of most? And I've started asking that question to everybody, and it's something, hey, we've got this running in our family. I just lost my brother to this, or my mom to this, or my dad to this. So I'm finding that by asking that question, that there is a chronic illness that you're afraid of. And for me, it's dementia, and that's what took my dad out. And so I have studied a lot on dementia and brain health, not just for cognitive performance, but for preventative. I'm taking a lot of things now that I will never see the tangible benefits of. It doesn't make me ripped or look better naked or make me stronger and my muscles bigger. But if my brain's healthier and reduces inflammation in your brain, and better focus, better clarity, better remembering things. Dihexa is one that I'm working with now. CMAC, C-Link, Apidolon was a longevity one that we put my mom on, and that might have been a big help with her cancer, big C word. So anyway, didn't mean to ramble on. I'm at just over 15 minutes. Love you guys. Thanks for being part of our group. I hope you enjoy your holiday weekend, celebrating with friends and family, and doing whatever you do. Rest. Sundays, take Sunday to rest. That's what God wants. That's what He says. So rest a little bit. He created the world and everything in 6 days, and He rested on Sunday. And a lot of us run around on Sunday and got all these things to do. Want to be busy, keep our calendars full, but put Jesus first and see what happens. So anyway, I'll let you go. I'm rambling on. Love you. Have a good weekend, and we'll do a pep talk soon.